Welcome to Canter Therapy Podcast. I'm Dr. Shelley Appleton, and I'm really excited about today's episode because it's absolutely fantastic. Kat and I are joined by Equine Dermatology vet Dr. Talia Morgan from Veterinary Dermatology Specialists in Western Australia. And I genuinely learnt so much during this conversation. We're talking about Queensland itch, allergies, asthma, head shaking, greasy heel, and skin problems. But this conversation goes so much further than simply talking about what cream, shampoo, or treatment you can put on your horse. Talia introduces us to the idea of the horse's allergy bucket, and it completely changes the way you start thinking about why one horse might be incredibly itchy while another, standing right beside it, isn't bothered at all. We talk about allergy testing, immunotherapy, and actually retraining the immune system. We explore the connection between allergies, asthma, and head shaking, why greasy heel isn't actually a disease in itself, how secondary infections can complicate everything, and then we get really practical. We talk about rugs, saddle pads, and all you guys out there that only clean your saddle pads or put your saddle pads in the washing machine, every couple of weeks, you guys are going to feel guilty, just letting you know. Shampoos, grooming equipment, skin barriers, dust mites, feed storage, and a whole collection of things we horse owners do every day without necessarily thinking about what they might mean for the horse's skin or immune system. There are so many brilliant nuggets in this episode. I came away from this conversation thinking differently about some really common problems we see in horses. And I suspect a lot of you are going to do exactly the same. So get comfortable because this is a cracker of an episode and you are going to want to listen right through to the end. And finally, if you love Canter Therapy and want to help Kat and me continue bringing you these conversations with brilliant people like Talia, please hit follow or subscribe on whatever podcast platform you're listening on and share the episode with your horsey friends. And if you'd like to support the podcast even more, head over to cantertherapy.com.au and you can find out more about Kat and myself, what we're up to outside of the podcast, and of course, get your hands on some very cool Canter Therapy merchandise. Right, let's get into this fantastic conversation with Dr. Talia Morgan. Good evening, Kat.
Good evening, Shelley. I'm excited for this conversation tonight.
Oh, yes. We do. We've got Dr. Talia Morgan from the Veterinary Dermatologist Specialists in Perth, in Osborne Park in Perth, actually, in Western Australia. And Talia is the Equine Dermatology vet at that practice. So welcome, Talia, to Canter Therapy Podcast.
Thanks for having me, team. What do I say? Long-time listener, first-time speaker. I feel like I have spent many, many hours with you two ladies in my car, driving to and from the barn, to and from visits. I feel like we're old friends already.
That's really good.
Actually, I had a lot of fun researching you. I like your fun facts. So fun facts I learned about Talia were that you've got 2 snakes. Do you still have 2 pet snakes?
I do, Penny and Patricia, yeah. So we've had them for a number of years now. Penny is a southwest carpet python. She's about 1.6 metres long, because that's always the question I get asked,
Yeah.
And Patricia is a Stimpson's python. She's about 90 centimetres long.
Wow.
Non-venomous, but pretty cool.
Yeah, very cool. I've actually, I've only met a handful of people with snakes, so that is very cool. The other cool fact is that you were once a flight attendant. I love that.
Yeah, I've had a multifaceted career. I always wanted to be a vet, but it just never got there until sort of later in life. Getting into vet school was hands down one of the hardest things I have ever done.
Yeah.
And so I did biology straight out of uni, and then I worked as a biologist. I did some sales repping for a bit, and then I just fancied something different. And so I don't know what possessed me, but I applied to be a flight attendant for Qantas, and I did that for a while. And then I remember walking around King's Cross on an overnight in Sydney on the phone to my mum going, I just want to go to vet school. And she's like, oh, really? Gosh, it takes so long. And then, I had to do my honours to get in because to boost my application. I did my honours in piglet welfare and behaviour, which was pretty cool.
Oh.
Yeah. And got into the vet program and hadn't looked back. It was just such a privilege to be able to deep dive into something I'm so passionate about. And thankfully, it sounds really corny, but I'm still really passionate about what I do. In particular, I find that equine owners and families, it's almost like cheating. They are invested. Having a horse in your life, whether that be for work or for pleasure, it's a lifestyle. And no other aspect of veterinary medicine is as committed to knowing better and doing better than the horse world. So it's a cool place to be. But I also think that the customer service experience that I got as a flight attendant hands down helps being a vet, because if I can't communicate to you the value of what I want to do and all the things that I'm thinking about, how do I get you on board and to know that we're all on the same page here? I really don't want to hear about how your children went in their running race or what have you, but I want to know all about your dog and your horse and your cat and your bird and your fish. So, I love what I do. I couldn't imagine doing anything else.
No, well, that's also our favourite topics of conversation, so that's brilliant. Now, I was very excited to learn about your dermatology position, because I think we talk a lot, Kat and I talk a lot about soundness issues, but really when it comes down to it, a lot of skin and allergy issues, especially where I live on the East Coast, as you go above Sydney and into Newcastle and into northern New South Wales and Queensland. Queensland itch is a big deal. Like, it can be a maker or a breaker. Lots of people will only buy a horse depending on its, if it's got itch or not. A lot of horses have to be sold into state or into dry areas because of it. It's just a huge issue that a lot of places in the world don't understand. And that's not the only skin issue that can become a problem, or just the mysterious ones that just happen. So I'm super keen to have you on. Now, I gave you a list. So what would you like to talk about first?
I like that you gave me a list. I think we've been working together sort of in a training capacity for a while now, and you clearly understood the assignment you gave. You could tell that I was a preparer. So giving me a list was really helpful. So you touched on head shaking, Queensland itch, allergies, asthma, and greasy heel. And look, I love that these are actually mostly all intertwined and relatable to each other. So and you're right, skin issues are so important, and they are not insignificant. Like, they're important issues to deal with to improve quality of life. And just with regards to itch, for example, I don't know if you've ever been really itchy. I was super itchy when I was pregnant with my second daughter, and I was so grumpy. And I had to wear mittens to bed so that I didn't scratch myself in my sleep. It was absolutely horrendous. So when these patients, dogs, cats, horses come to us and they're itchy, I feel like we have the opportunity to really improve their quality of life, because being itchy is the worst. And certainly not all allergies and not all skin conditions are itchy, but if there is an itch component in there, I really want to help these teams out to improve their quality of life, because it's the worst.
Oh, yeah, it is. And it's so fascinating how a lot of people don't realise that can affect their behaviour or just the animal's happiness. And I've facilitated a lot of sale of horses from one end of the country to the other because of itch conditions. And it's really interesting seeing the horses on the other side. I remember distinctly one lovely horse that was grey, who, when she was getting lighter as she got older, but she was perpetually pink. And then when she went to Western Australia, she actually became like her proper colour, because she was pink because she just scratched herself to death. But just the change in her ability to cope. Where she lived before, she had terrible separation anxiety. And then, of course, when she moved, all that changed because she wasn't struggling with the burden of feeling perpetually itchy and uncomfortable.
Yeah, I don't think I'd appreciate someone trying to ride me or ask me for contact or to move off their inside leg if I was just wanting to get to that scratch.
Yes.
Now, yeah, I can see how frustrated they would be. And I suppose that's where really what we're trying to do at Vet Derm Specialists is improve the access that owners have to equine dermatology services. You don't have to live with these symptoms and just be managing them every year. And, it's getting better because the seasons have changed. Oh, but hang on, now we're itchy again. Oh, I've got these secondary infections. Oh, now it's worse. Oh, okay, it got a little bit better with that cream, but now it's gone away. But, hang on, but now it's worse. If we can actually get to the root cause of the problem, then, remove that back and forth or having to move your horse interstate. Like, that's a pretty severe consequence of your itch. But I suppose with allergies, it's important to remember that it's not just itchy. There are many symptoms which wouldn't typically be classified as allergic symptoms, but it's important to be aware of. So obviously there's the itch and then the secondary scratches and hair loss and secondary infections that come with that. But also the respiratory symptoms that sort of fall under the asthma umbrella. So we talk about persistent cough, nasal discharge, exercise intolerance. I mean, asthma is an allergic disease. So keeping those in mind. Then there's the behavioural and neurological problems. One of my favourite patients that I love to talk about, Diamond's primary concern or symptom with the allergies was head shaking. And it really just meant that her and her owner just couldn't connect. And when we were able to test what this horse was allergic to and then formulate the vaccine and then desensitize them, and then the owner says, I got my horse back. I mean, I can't pay for marketing like that. For her to say, I got my horse back, that's just, life-changing. And so they've been able to go on and have this beautiful life together. I did ask for some photos recently. We were doing a social media push and I got all these pics from showing to professional photos to at home to like on the trails. It was just magnificent. And that's such a great improvement in their quality of life. So it's not just the itchy pony. Sometimes it's the hair loss, the secondary infections, the respiratory symptoms, and then the behavioural.
Yeah, wow. All right, what shall we tackle first?
So if we're talking about allergies, you mentioned Queensland itch and how sort of frustrating that can be for people. The curious thing about Queensland itch is that vets and dermatologists and researchers have been doing research on this disease all over the world for a very, very long time, right? So it's got lots of different names. And so these bodies were researching it independently, not knowing they were researching the same thing. Wow. So Queensland itch, also known as summer itch, summer eczema, adobe itch, sweet itch, colicoides hypersensitivity, insect bite hypersensitivity, summer seasonal recurrent dermatitis. It's called casein, I believe, in Japan, seasonal pruritic dermatitis. So essentially all the same thing, a hypersensitivity to the colicoides midgii, also known as noceums in the States. And so it's an IgE-mediated type 1 allergic reaction. So unfortunately, the colicoides, there's different varieties or species of them all over Australia, and they're all a little bit different. And then they all like different parts of the horse. Some like to attack the legs, some like to feed on the back or the mane or the tail. So it's really tricky, but essentially it's all the same thing, insect bite hypersensitivity. But the curious thing about it is that if you think of the capacity your horse has to tolerate allergens in the environment. If you think of it like a bucket or a threshold, okay, so I'm finding the hay a bit dusty and there's a bit of mold in there and there's a pollen over there that I'm affected by, but I'm okay until you then get attacked by the colicoides midgii, and then you've just gone over that threshold and you've overreacted. Whereas if we can identify all of the triggers in the environment that the horse is allergic to and that the immune system is over-responding to rather than being tolerant to, then when we can desensitize them and essentially retrain their immune system to not overreact, then when they get attacked by the colicoides midgii, they're not pushed over. The bucket has a greater capacity. We've widened the zone of tolerance to be able to, so that they won't suffer so badly. So these horses are often allergic to many other things. And when we test for allergens here in WA, we test for about 65 different things. We've got 2 ways that we can do that. We can use a blood test called a HESCA test, and we can also do intradermal allergy testing. And I suppose the beautiful thing about, I suppose not great about COVID, but just with technology and how we're advancing, is that we can see so many more patients now through telehealth. I can have photos and videos and histories, the history from your regular vet what worked, what didn't work, when does this happen, what did you try, what was happening at the time, do we have other diseases going on? And we can help patients all over the place. Oh, your regular vet, they can pull a HESCO, send it to us. Let's have a look. Oh, amazing. Let's formulate the vaccine. Let's get that horse's immune system, retrained, so that then when that season comes around again, we're not then dealing with that overwhelmed immune system. And the desensitization is really getting to that root cause so that this doesn't just keep happening. We keep chasing our tails, per se.
Yeah. Can you explain, I think I know what you're talking about, but can you explain what did you say intradermal tests?
Yeah, intradermal allergy test. So there's two ways so I suppose if your vet has diagnosed your horse with allergies or environmental allergies, also known as atopy, we know they've got environmental allergies. We want to know what the causes are, or what the triggers, what is triggering this patient's immune system to overreact. So we can do that in two ways. We can take a blood test, which looks it's sort of sent off and looks at what your horse is overreacting to, and then we can do an intradermal allergy test. So we clip up about an area the size of a postcard on the neck of the horse. We do that with your local vet. We work in tandem, and we clip that up, and then we inject tiny little amounts of all the different allergens that we want to test for into the skin, and then we measure the reaction compared to a positive control and a negative control. The positive control is histamine, the negative is saline, and then we measure the horse's reaction. And so we're then using that information. Ideally, both tests is great, but look, if you're living remotely or you can't get to a clinic or what have you, we can often just use the blood test and we can get enough information to get going there. Sometimes the blood test just doesn't give us enough information to get cracking, and we really recommend both. And ideally, in a perfect world, I'd always have both to go off, and then we can formulate the vaccine, which then over time administers tiny portions of those allergens, and that's bespoke to your horse, so unique to what they're overreacting to then retrain their immune system. So the desensitization is so many benefits to it, or sort of pros, you might say. There's side effects to so many things that we do. You've got to be really careful with steroids with some horses. You've got to be really careful with anti-inflammatories with others. They've got other things going on. As much as I care about the skin, there are other components to the horse we have to be cognizant of, right? And so, for those that are into medicine and science, well, it's the only thing that's going to get to the root cause. But if you're into, less medicine and more holistic care, well, it's actually just retraining the immune system. It's non-swabbable for competitions, for example. Obviously, it wouldn't be allowed on the injection days because it's just a subcutaneous injection that owners can do at home, unless they're needle phobic, obviously. And so it's just really retraining the immune system rather than a drug per se. It's tiny amounts of the allergens, and we build that up over time just to retrain the immune system away from overreaction and over to tolerance.
Yeah, fascinating. So why then, probably what you've just said then has actually helped explain it, but you'll get some horses that have no reaction to it, like they're itch tolerant, and then those that are really predisposed to it. You'll also have some horses that will get it somewhere and then move them a little bit and they're not. So just tell me if I've got this right though. Okay. So the horses that don't get it, they've got either a very good immune system, or they're not sensitive to allergens or particular allergens, or they're not overloaded, or their immune system's in good shape. So horses that are predisposed to it, they might have a full bucket of things that they're allergic to. They might be specifically allergic to the midgie bite or whatever. So I'm on the right track while there seems to be such variations in some horses that get it and some horses that can't.
Yes, definitely. And I'm sure there's a genetic component, but it's exactly right. If your immune system's already overloaded, that last thing, and whatever it is, was it, an increased pollen count just because it's that time of year in the neighbour's tree, or is it some slightly mouldier hay and there's some spores in there, or is it the colocoides, or is it mosquitoes? Whatever it is just pushed you over the edge. Because you've got all these other things filling up that bucket, that capacity of your immune system to deal with things, whereas another horse might look, I find that mosquito bite or the colocoides my immune system's going a bit bonkers as well, but I've got enough capacity because the mold hasn't annoyed me, or I'm outside, or there's a different load on that horse's allergy bucket. So yes, they're all a bit different, a bit like us. You or I might have the same disease and you respond to treatment really well, whereas I don't. Or we might, with ulcers, grade 1 on one horse doesn't look like grade 1 on another if you're particularly sensitive. So they're all a little bit different. So that's the great thing about the desensitization is that we can really formulate that vaccine specifically to what's bothering this horse. Because you might think, oh, okay, you're having a look at the results. Oh, wattle. Oh, that's okay. There's no wattle on my property. But particularly in WA, I talk to families about a 30-kilometre radius for allergens. It's warm, it's windy. There's no avoiding these allergens. These particles, these allergens are tiny. They're on the wind. We can't see them. We can't get rid of dust, for example, and the exoskeletons of all the insects that are broken down into dust. Yes, we can reduce the load in the hay, soaking the hay, steaming the hay, keeping horses outside rather than in a stable. But there's just, unless we wrap them up in a bubble, I don't think that we're ever going to fully get rid of them. I mean, that information is still helpful with regards to allergen avoidance. So, for example, sometimes it's identified on the tests that horses are overreacting to storage mites. And unfortunately, storage mites, they like to live and breed in stored feed. So for our dogs and cats, that's in our kibble bags, the dry biscuits. And for horses, it's in the bags of feed. So, freezing portions of feed or the whole bag in a chest freezer can delay the breeding or stop them from breeding and the numbers multiplying. But otherwise, you're having to rinse out the bottom of the feed dishes every day just because they're in that dust that's at the bottom of the feed. Another one is if your horse is identified to be allergic to dust mites, they like to live in our fabrics. And so, when I go to the stock feeder, I want to choose a nice material for my horse's rug because I think that, I wouldn't want to wear a plastic bag. So I'll choose a natural fibre like cotton. Well, who else likes natural fibres? Dust mites. And so if your horse does have an allergy to dust mites, putting on that rug where they can live and breed and eat in there is just putting the allergen directly on the horse. So then we've got to go, okay, we've got to choose something cheap and cheerful, the polyester, the synthetic fibres that the dust mites won't live and breed in. And then when we wash them, we've got to wash them really hot, above 55 degrees. But does your hot water system go that high? Because some of the modern hot water systems have a safety feature. So then, okay, what else can we do? We can dry them in the sun, eucalyptus in the wash. So this information, yes, it formulates our vaccine to retrain the immune system, but it also gives us these other management nuggets to be using in the meantime, because the desensitization it's a process and it's not a quick fix. We talk to families about it takes 6 to 12 months to see a benefit from the immunotherapy because it takes time to retrain the immune system. And what does sort of success look like? A reduction in symptoms and a reduction in the medication needed to manage the symptoms. So certainly having been an emergency vet as well, I like it done, right? I've got to put my patient pants on here and wait for the results. And in the meantime, there are these strategies we can do. I suppose it's important to remember too that these patients, these atopic patients, horses with environmental allergies, we know that their skin barrier is not as robust as a patient who doesn't have environmental allergies. And so we need to be working on maintaining and helping to repair and really keep top-notch that skin barrier to keep these things out, to keep out the allergens, to keep out the bacteria. And so we'd like to do that from the outside in using topical ceramides, which is the oily fatty layer between the skin cells. If you think of the skin cells like bricks, the ceramides is the mortar between them that helps to keep things out, also helps to keep the moisture in, if we're honest. And so we can apply things topically there and also adding in fatty acids to the diet as well. So it's a multifaceted sort of approach. We've got the immunotherapy, we've got repairing the skin barrier, we want to deal with any secondary infections. So if you've scratched yourself red raw on a post, And then, dirt and germs have taken advantage there, because sometimes it's not just the allergies themselves that create the itch. Inflammation is also really itchy, and infection is itchy. So if we've got the allergies and the inflammation and the infection, no wonder they're itchy. So we need to get on top of those secondary infections and find out what's growing there. Horses have a lovely tendency to grow multi-drug resistant bugs. We've got to be really careful when we've got family who are touching them who might be immunocompromised or have issues in that department, and they like to grow weird and wonderful things. So that's where I get to do cool stuff like take swabs. Similarly with the greasy heel. Greasy heel's super frustrating because what's growing there we need to find out, and often we need to adjust our treatment protocol to find out why isn't this treatment working? Because it's not actually bacterial, it's fungal, and we need to go a different route. So getting on top of those secondary infections, super important.
Yeah, God, I got 100 questions for you.
I'm so sorry. I talk so much.
There. Kat, do you have any before I launch into my
go for it, Shelley.
questions? Okay, first of all, I'm super interested about kind of barrier type things we can apply to the skin to form those barriers. What kind of products would they be?
Okay, so there are a few. There's the Essential 6 is the topical fatty acids that you pour onto the wither, and then it's really cool. You kind of, and I see when I pop it on, I see owners kind of itching to rub it in, but no, you just let it use the spider web of matrix of the skin cells to disseminate itself over the coat, and it's just so great. So the Essential 6 is one. The other one that I've been using recently, and I dilute it in a spray bottle, like 1 part conditioner to 2 parts water, is the Pore leave-on conditioner, and that's great because it's got the ceramides in there, but it's also got colloidal oatmeal, which is anti-inflammatory for the skin. Yeah. So they're the two that I'm using at the moment, but then other topicals that your vet might prescribe you, or that we as a dermatology team might just prescribe, would include like an antifungal if we identify that there's a fungal component, or is there an antibacterial because there's a bacterial infection, and it'll all sort of depend on the particular case. But for your just general wanting to help to maintain the skin barrier, those are the two I like. But keeping in mind, the best way to hit it is from multiple angles, and we like an inside-out approach. So I also want to be adding in those fatty acids to the feed. I know a lot of people like to add flax seeds into their feed. The more I research these things, unfortunately, about, between 4 and 11%, the literature says, of that flaxseed is actually converted into the EPA and the DHA that we need, or that the horses, need. And so we're not getting as much bang for your buck as we are for a product like EO3, which is the one that's got the most literature behind it at this stage. So that's the one that I'm prescribing for my patients.
So just going back to the Pore product, is that how
yes, it's a Nutriderm leave-on conditioner, and it comes in like a conditioner, but just for ease of application, I pop it into a spray bottle. 1 part conditioner, 2 parts water, and it's just gorgeous. Smells really nice.
So that's really interesting. It really is saying, you've really painted a really good picture of how this is a holistic treatment, going to the root cause of being able to deal it with immunisation, vaccines, to desensitise the immune system to it, plus everything we can do on the outside, plus any other little bugs it's got in. And I suppose this is why there's everyone's recipe for itch, or, greasy heel that we just talked about, or mud fever, or anything, how it can be distinct little things to a particular area, and why everyone has their recipe for it in their area. But sometimes they don't work, and that answers why. It's because it can have different bugs.
It just depends on what's taken advantage, because any time that the skin is inflamed, we've got things living on our skin normally that aren't taking advantage. There'll be bacteria there and there'll be fungal spores there, but they're not going gangbusters because, my skin's barrier is keeping them out. But then when there's inflammation, it goes, ooh, hey, the pH has changed. It's the barrier is broken down. I'm going to take advantage of this situation, and that's how we get secondary infection. And remember that's the inflammation and the infection on top of the allergies. That's all super itchy.
Yeah, super interesting. So getting back to those protective ceramides we can apply to the skin. So we had Pore. that you can make up into certain quantities and spray on the skin. But what was the other one? The Essential 6?
Essential 6, yes,
Yeah.
the Dermacent Essential 6. So there's different formulations. It comes in cat, dog, and horse.
Yeah.
And they're little sort of vials that you pour over the wither, and then it disseminates itself over the coat. And that's really just helping to replenish the ceramides, that mortar between the brick skin cells.
Yeah,
helping
so
to
forming
keep
a
out
barrier.
the things we want to keep out and keep in what we want to keep in, which is moisture.
Yeah, fabulous. All right, very interesting so far. I've already learnt a heap, and I'm sure everyone else has as well. Okay, Talia, next.
Okay, so, ladies' choice, greasy heel or asthma?
Oh, let's talk more about greasy heel, because we need that kind of all fits into the same thing. Again, greasy heel can cause behavioural problems. People always go, oh, do you think this could be making him a little bit more spooky than usual? It's like, yes, because it's quite uncomfortable.
I think any kind of pain and discomfort would cause me to be a bit of a pain. Yeah, 100%.
Yeah.
And so it's pattern dermatitis or greasy heel. So it's really a cutaneous reaction pattern, so a skin pattern rather than a disease in itself, because again, we need to discover the underlying primary cause. And that's where you'll find, my magic goo, it's always worked and I've been doing this for years, and then why isn't it working? Because there's a different underlying cause. And so is it bacterial? Is there a parasite there like mange? Is it there's another chronic progressive lymphedema? Is it immune mediated? Do we have a photosensitive reaction to a toxin or something else? Is there a fungal component? And so getting to that underlying cause is really important, and your vet can do cytology. So we'll get either a little scrape or some on the microscope slide and have a look, what is going on in there. Sometimes biopsies are needed. And so that's really where if it's not responding the way it normally would, that's when you should really call in the vet or your dermatology team to help identify the underlying cause to get to the bottom of it. With regards to management for greasy heel, once you've identified the underlying cause, the treatment being gentle with the area, not causing more harm, by cleaning it too vigorously, because then we're going to be susceptible to secondary infections that we already know, bacterial, fungal, that's going to be a pain to treat. Keeping them dry. So clipping the area can be really helpful to help keep it dry. But it's just one of those things, in the winter it's wet, in the summer we reticulate. It's, keeping that area dry and again protecting the skin barrier and helping the horse to keep things out.
Yeah, wow, very cool. All right, thanks for that. Okay, let's tackle asthma.
So I feel like maybe historically the internal medicine vets and the dermatologists weren't going to the same parties, because asthma being an allergic disease and equine allergies, how have we not, how are we not treating more horses with asthma by, finding out what they're allergic to and desensitizing them? So it's certainly, there are, vets all over the place doing it and have great success, and the literature is catching up. But at the end of the day, if your horse has asthma, why not give this a whirl? I mean, nebulizing horses, no one's having a good time there, are they, with steroids and what have you? And then you can't compete or race, on antihistamines or steroids. So that's essentially, I'd love to get these patients off antihistamines, off steroids, and feeling better and breathing better. And if, exercise intolerance, cough, nasal discharge, it's no fun for anyone. So certainly, I think that's previously been overlooked as a major sign or symptom of allergies. And if we think about the statistics, 1 in 4 horses is going to have allergies in its lifetime. And I say in its lifetime because the immune system is an ever-changing beast, a bit like people, I say people nurses as opposed to veterinary nurses, like people doctors, wear gloves for years and years and years and years, like in the hospital setting, with powder in, and then one day they can't use powdered gloves ever again because they've developed an allergy. So the immune system, ever-changing beast, 1 in 4 horses is going to have allergies. So I think it's been previously underrepresented as an issue of concern.
Yeah, I think also, do you agree with this statement that it really depends on the stress load on the body, full stop, and aging, ill health, diet, management, what they've been exposed to by the plethora of allergens, if there's been something compromised or whatever. It's the immune system's copying it all. So I suppose that makes sense. And interesting how you say about the respiratory specialists and the dermatologists not really speaking. It's like in human medicine, very common that when you've got kids with asthma, they've also got eczema. And so that's always seen as like a bit of a combination thing. So super interesting.
Yes. One of my favourite sayings, and I think being a vet is particularly humbling, right? I mean, similarly, I think being a vet and having a horse in your life, there's so many overlaps. You are humbled regularly. And so I'm always happy to learn new things. Is there a new way of doing it? Is there a new method? Do we know better? We can do better. You know, if you say, Talia, I've just found out that this drug works better when you do it like this. I know you've been doing it for 10 years like this, but guess what? We're going to mix it up. I'll be like, yep, cool. Show me how it's done. Let's do it. There's no room to get butthurt about being humbled. But
I bet you come across some sticklers. I bet you come up, but I've been doing this for 53 years. We don't use it like that.
No, definitely.
Finding it super interesting because in human medicine with asthma, I don't think most people tackle asthma by looking at the immune system yet. So I hadn't even thought about asthma being, I guess, of course it's an immune response, but I'm like, oh, yeah, okay.
Yeah, they do. They do. That's all kind of been coming along lately. That's how a lot of the medications work, is by tackling that. Yeah, and there's a lot to do with trying to reduce like allergen load and stuff like that. But again, it's like there's such a focus on just treatment. Just what do we put on it? Here's a puffer. There you go. It's like not really delving into the why, the why, the root cause of that. Maybe.
There's certainly a lot happening in the human medicine side of things, and things are progressing in it, and veterinary medicine. So some animals are similar to people with regards to how their bodies react, and other times it's not so. So, for example, the shock organ of the dog is the guts, the gastrointestinal system. So their gastrointestinal system is the first sort of system to cop it, whereas people, it's the respiratory system, cats' respiratory system. So they're all, a little bit different. And so we've got to see, okay, what's happening in the human medicine side of things? How does that correlate? Are they the same cells? So it's an evolving space, and it's tricky. I'd love to have all the money to do all the research on all the species, but funding is a limited thing.
That's the thing about veterinary medicine, though. Human medicine, we just got one species. That of course there's difference in male and female, and there might be some particular different ethnic group trying to changes in genetics and stuff like that. But poor veterinary medicine, you've got like this plethora of species, and they're all different with their different tolerances and their different metabolisms and things like that. It's quite extreme for what you guys got to get your head around.
Again, humbling. You've just got to take each case as it is. I have trained my children, maybe not so much now, they're a bit sassier, but when they were little, I'd train them to say, real doctors treat more than one species.
Fair enough too. It's true. So one question is especially when it comes to asthma, I see a lot of horses developing asthma after their properties or themselves have been through a bushfire.
Interesting. I suppose the load of particles and allergens in the air, everything would just be in the air.
Yeah.
And these particles are so small, it's sort of no avoiding them. And just think of all the extra things you're breathing in. Rush. It's enough for anyone's immune system. And surely a bushfire would also be stressful. I know that my immune system took a copping, after every exam period. I would, cram. And then I'd be like, oh, awesome, I've got a break. And then I would get a cold. So to what you were saying before about the
stress
body
load
being affected for other things, I'm like, yes, it would all be interconnected. And one of my favorite sayings is, it's always more complicated than that.
Yeah.
Just when you think, okay, this plus this equals this, but it's always more complicated than that.
A lot of variables involved. So Talia, what's next on our list?
Well, I think we've essentially, so we've covered, with allergies, we've covered asthma, we've covered Queensland itch and all its many, many names, and head shaking in there. I suppose I would love if I could fix all of the head shakers by desensitizing them to whatever's triggering them. But obviously there are other causes of head shaking. But just if your vet cannot find a cause, let's talk about allergies, because sometimes I'll be having a chat, whether it be an adult riders club or pony club, or I went to interschools this year. That was a lot. And I'm talking to people about their horses and, I don't have any skin issues. And I'm just, patting and talking to the kids. I'm like, what's that? Oh, what's that? Oh, yeah, that's just a lump he's got. I'm like, well, that's an eosinophilic granuloma. Horses like to make those. Eosinophils are one of the white blood cells, and it just feels like a tiny little pebble under the skin, and it just, yeah, he's always had that. I'm, no, he doesn't have any issues. And I'm like, what's this here? Oh, he rubs that out. I'm like, is he a bit itchy? No, he just rubs it out. I'm like, okay. So it's,
Perception.
One of those things you can, everyone's perception of the situation is different. Even as a new grad vet, I remember talking to someone about their dog. And I said, oh gosh, Fluffy's got a sore leg. Oh no, he's not in pain. I'm like, well, he's walking on 3 legs. One of them's in the air. Oh no, but he's still eating. I'm like, right. Yeah. So their perception was that Fluffy wasn't
for a while.
Yeah, Fluffy's not dead. Fluffy's just in pain. So yeah, it's curious, different people's perceptions of what is going on. But it's why having a look at the whole horse and knowing your horse's skin, and when you're grooming, yes, it's a good time to bond, and it's a bit of TLC, and they're getting that attention. Hopefully, it feels good for them. But also getting to know what's normal for your horse. They've got a swirl over here, and they've had a bit of a knocker. I better keep an eye on that. And just getting to know the landscape of your horse, what's normal for their coat. Has this patch here always been bald? Is that getting bigger? Better take a photograph, and then you can, track things as they go on, and knowing what's normal for your horse and your horse's skin is, super important. I often get asked about how often should I wash my saddle pads.
Yes. This is a good question.
It's a bit contentious because I see people in the crowd looking a bit sheepish sometimes when someone asks this one. And certainly if your horse is sensitive to whatever's living in the saddle pad, that can be difficult. I tend to describe it like activewear. If you've had your exercise pants on and you've just gone to the supermarket, that's fine. But if you've done a big workout and you've got nice and sweaty, would you wear them again? I would give those bad boys a wash. Yeah, because obviously the dead skin cells and the sweat and the bacteria are all going to be growing in there, so that might be unpleasant. So certainly I wash mine more than your average bear, I think. When I see some in the tack room that I swear are 80% hair, I think, that could probably do with a wash.
Yeah, because you're really just pressing in a whole lot of, like, a whole colony of microorganisms, rubbing that into a friction zone on the thing. So probably not a good idea. Yes, so that's a really good rule for it. Okay, so we talked about saddle pads. Can you tell me about rugging? How often should we wash our rugs?
Okay, so washing them, I suppose, as we mentioned before, if your horse has an allergy to dust mites, making sure that they're washed regularly and dried out in the sun, or do you choose to keep your horse unrugged? Obviously, that'll be a bit trickier in winter, although, without throwing any shade, I have a feeling we tend to over-rug our horses a little bit. Any over-ruggers here?
Yes, let's look at Kat, everyone. Let's look at Kat, declared over-rugger.
So we don't want to... we don't want to look at it like, okay, it's 8 degrees. If I was standing in the paddock, I would want to rug on the thermoneutral zone of a horse, or there's a range of temperatures where the horse doesn't need to expend any energy to shiver to keep warm, is below 5 degrees. So if it's 7, 8, 9 degrees, they're fine. They don't need a rug on, whereas I would want a rug. And then below that, they will need some support. Obviously, they might need some support before it gets to 5 degrees if they've been clipped. And I know there are some very strong feelings about clipping as well. Clipping can be really helpful if you have an allergic horse because it's easier to then wash the allergens off. They're not sitting and being stuck in the skin in between the hair, so that can be really helpful. But then would you like to leave the saddle area of the horse unclipped as a barrier for friction for the saddle? I think I would appreciate that. People tell me that shaving and then friction is unpleasant. So, but then if you're showing, we don't want to do that, and so it's really tricky. But so clipping can be really helpful for those horses who you want to help keep those allergens off.
Yeah. Okay. Next question. What about tack? What about girths?
Everything that touches the horse. Regularly, Shelley.
How often should you clean that?
Look, that really depends, how dirty it is. And look, I haven't really deep dived into it. I was actually thinking recently, some things, a bit like when, head lice, you get the dreaded email from the primary school to say head lice has gone through the child's class and everything has to be washed and you're boiling the kettle and what have you. Some of our grooming products, they've got a leather strap or a wooden base with these nice fancy brushes. I'm like, well, I can't boil that bad boy. I can't.
Yeah.
So keeping things in clean and in good working order and not using them between horses if you don't want to spread germs and what have you. But I think just keeping tack clean and in good order. I was talking to someone recently about how often they wash their bit, and she said, I never wash my horse's bit. And I thought, I would think of it like a mouth guard or a plate or a retainer. Imagine not washing it and sticking it in your mouth again.
Yeah.
Yeah. So I like to have everything clean and in good working order.
What about brush sets? How people have just like one grooming set or they have multiple grooming set for each individual horse. Do you have a recommendation for that?
No, I think if you've got an issue and you don't want to then be transferring it to another horse, but otherwise, if everything's clean, I don't see how that should be a problem.
Okay.
Especially for me, I think about it all my horses are paddocked together. So I'm not going to have separate grooming kits for all the horses that are in the paddock together anyway.
No, because you've got a herd environment and they do need to be treated differently. And, so you'll be aware of how the worming schedule will be different for a herd environment because you might have a shedder and a non-shedder and the horses that are susceptible to different things. But obviously if you've got a horse that's then got an infection, you're not going to go and rub anything on there and then transfer it. But yeah, it's really cool that you've got that herd environment. That's great.
Yeah.
So do you have any other frequently asked questions? Because that was some good ones.
Yeah, sorry. Shampoos, when I go to the stock feeder, it's overwhelming. I can see how horse owners are overwhelmed. There are a lot of products. There's some sexy packaging. There's, claims.
Those that smell nice.
Yes.
Get the tangles out, make them white.
And then cost is a concern as well. One question I got asked was, hang on a second, but can I just use people shampoo on my horse? Because, the Teresme was on sale. Can I just use that? That's when I get asked quite a bit. And horse skin and human skin have very different pH levels. And so if you were to use your human products on your horse, they would be far too acidic and would be quite unpleasant. So I don't recommend using human products on your horse. The products I've got a lovely German riding pony called Max.
I know him.
Love of my life, that guy. He's so great. Again, super humbling. Had a lesson today and I was talking to my trainer so I've been working on this and it's going really well. And then she did that thing that she does and she sort of peeled back the curtain to show me a few more hundred things that I didn't know. And I'm like, oh, wow, this is so good. I don't think, similar to being a vet, is the overlap I was talking about. Being a vet and having a horse in your life, very similar. The learning is never ending. It will
that's what's fun about it.
Yeah.
The pursuit.
yeah, I don't think I can fit it all in before I pass away. But no, particularly humbling. So for Max, who is not an allergic pony, I really like to use Allervine on his coat. And because a lot of people like to use Maliceb, which is an antifungal component, but it's quite drying. So unless you have fungus as a component of your horse's skin disease, then it can be quite drying. So Allervine is one that I'm using at the moment for Max. It's got the colloidal oatmeal in there, which is anti-inflammatory. It's just really nice. But look, I don't think you can go wrong unless you've got a particular problem you're targeting, and then talk to your vet about the best product for the job. But yeah, it's a significantly overwhelming landscape of products, that's for sure.
If you've got, the whitening, the purple shampoos and stuff like that, can you overdo them and actually cause like an irritant injury to the horse's skin?
I'm actually not sure about that. No. I mean, my personal experience with the purple shampoos, as Max is a very lovely Palomino, is I only use them for his mane and tail, so they're not actually on his skin. But if you were purple shampooing your whole horse, I would definitely want that purple shampoo to be formulated specifically for horses, or even dogs at a stretch, because dog and horse skin and pH are much closer to horse and human. But no, because I believe that the purple works by balancing out the yellow. So if you think of the colour wheel, purple and yellow are opposite, so they're putting in purple to de-yellow the yellow, rather than bleaching the hair itself.
Yeah, okay.
If you leave purple on too long, you will turn them purple.
Thank you. Yeah.
Is that from personal experience?
Yeah, it is.
I've done
Was it the whole horse or just the tail?
Sometimes the dog too,
Fabulous.
Oh, Talia, that's been a fabulous conversation. We have really pulled a lot of information out of you, which has been so helpful. I think just to summarize what I've learned is just to really look at it as a real holistic approach of how to actually help these horses, instead of just going, okay, what can we put on it to fix it? It's not about just what you put on the top. It's about what's got to go from the inside. And it probably explains why I've had a lot of people that get treatment failure and things like that, is because they're really not looking at it or understanding the whole holistic approach. So I think that's been fabulous. And I also did not know about the pH difference from human skin to horse skin, and I think that was a real nugget of gold there. Yep, just putting away the shampoos on special and pulling out my horse ones. And even wondering, that's made me go, I wonder if these shampoos have actually been formulated for horses. This is
the industry wasn't regulated, so there's
it's not regulated. So that's made me go
them and the horse industry to make them correct for the horse.
Yeah, this off to examine that. So yes, very helpful information. And we'll definitely get you back, because I'll give you another list of things.
Oh goodness. Okay, cool.
I want to talk about photosensitivity, because that's one that's close to my heart, but next time.
Yes, next time we'll
100%.
dive into that. Okay, my friend, thank you very much for coming on. Very grateful for your expertise. It was very entertaining and informational from all over Australia. That is very cool. And yes, everyone go on to Instagram, follow Talia. What was your page?
Talia.
Dr. Talia, find it, follow her, send her pictures.
Definitely.
Well, I think you just gave me permission to send you pictures, Talia.
Yeah, Kat,
I'm all for it.
It's already going to send you some. All right, my friend, thank you so much for your time and your expertise. I'll say goodnight. So thank you very much, Talia.
You.
See you
Thanks
later.
for having me.
Out.
Okay, catch ya. Bye.